This form is basically a communication form between the PT and the PTA, indicating for the PTA what aspects of walking need to be worked on. And copies are usually, the blank copies are usually kept in the PT binder so the PT can easily fill it out, and then they give it to the PTA, who keeps it in their binder for as long as the resident is on the walking program. So again, we have the name and date of birth at the top, and any medical history or comments that are pertinent for the PTA to know in relation to their walking. So I don't know, maybe they still have a lot of hip pain because they had a hip fracture or something like that. Whatever you may feel that the PTA needs to know. If there's anything specific about their hearing or vision, what's their current weight-bearing status. For the sit to stand and stand to sit portion of the walking, if the resident needs verbal cueing or tactile cueing, some sort of facilitation technique, assistance times 1 or 2 to stand or to sit, and then you can indicate if it's minimal, moderate, or maximum, and or if the resident is independent for both of those two components, sit to stand and stand to sit. Then under ambulation we have equipment. You can tick off what type of equipment if the resident is using equipment. You can mark the grip height of the walker or the cane if you want. We have seen in some homes the heights of the walkers change often because family members come in and think that they're doing their loved one a favor by putting the walker up higher or putting it lower. So if that is an issue, you can indicate here that you have adjusted the height to whatever inches or however many holes are showing if you wish. If the resident, sometimes residents who have dementia walk better by holding hands of the person that they're walking with versus using a mobility aid. If that's the case, you can check that off and say if it's better to hold 1 or 2 people's hands, and if it's their right or left side, that's better to do that with. Also, how many people need to assist the person to walk? Is it 1, 2, or 3 people? And do you need an extra person to follow with the wheelchair? So if you want 1 person to walk beside the resident and 1 to follow with the wheelchair, that would be an assist of 1 + 1 to follow with the wheelchair. Footwear description location, that was put there because in some cases residents, sometimes their footwear is hidden from the resident, just so that they're discouraged from walking by themselves. And so if the footwear is kept at the nursing station or kept in a locked cupboard somewhere or hidden from the resident somewhere, you can indicate that here just so the PTA knows in case they don't already know. And under recommendations, we have rehabilitative walking program 3 to 5 times per week, and we've got that it's with the PSP, and we've got the goal there already. And if there's a different goal, you can indicate it. And here I will either circle 3 or 5 if I don't want the resident walked 5 days a week, although if somebody's on a walking program, I truly believe that it's a good idea for them to walk 5 days a week, because if they only walk 3 times, then that means there's 4 days they're walking less days than they aren't walking. So I think it's a great idea if somebody needs to be on a walking program that they're walking Monday to Friday. That's just my humble opinion. Also, if you can indicate if it's for gait training or fitness benefits, we talked about that in a previous, when we were discussing the initial assessment form. So if there's actually gait training that you want the PTA to do, you would indicate that. If it's more for endurance that you're doing the walking and not so much the quality of the walking, you would indicate fitness benefits. And this is important to note on the form so that your PTA knows in Coligo which walking program modality to put on their minute screen if it's for gait training or fitness benefits. You may want to indicate for the PTA what they need to look out for. So is it because the resident isn't taking high enough steps and their feet are dragging on the floor and you want them to look for foot clearance? Do you want them to focus on getting the resident to look ahead instead of looking at their feet? Do you want them to focus on the resident keeping their walker close to their body, not leaning with the walker far ahead? Maybe telling them it's better for their back if they keep their back up straight and they keep the walker close, things like that. Do you want them to focus on getting the resident to use a step-through gait instead of the step-to gait? Or is there something else in terms of the quality of the walking that you want them to work on? And so that's what this form is for. It's to make it very easy for the PT and fast to communicate to the PTA what am I looking for in this walking program and what are the goals of the walking program. And now we'll take a look at the chest physiotherapy program form. That's what it looks like. And And this is a one-sided form again, similar to the walking program information form. This form was created to quickly and efficiently communicate to the PTA what the goals of the chest physio program are for the resident. So again, you have the resident's name and date of birth at the top of the form. There's a paragraph about precautions just to remind the PTA and whoever else may look at this form of what needs to be discontinued in terms of treatment if there's a problem. To always contact the physio if their condition has changed. Suggested technique, so for example, mechanical percussor, if you want them to use I used to call it a mechanical vibrator, but I've changed that to the official word of percussor. How many minutes, and if you want them to do it in the back, in the front, the top, the bottom, whatever. Do you want them to do deep breathing exercises? How many repetitions? Sustained maximal inspiration. Do you want them to do it with or without percussions on sustained maximal inspiration, SMI? Pursed lip breathing for exhalation. Incentive spirometer if there's a specific setting you want them to strive for. Percussions, clapping in brackets. Manual exploratory vibes or shaking, fine or coarse. Cough assist with pillow splinting, cough assist and crook lying, cough assist or stimulation with the forced expiratory technique or huffing or something else. You can also mention if you'd like them to do the treatment in supine, right or left side lying or in sitting. You can check off which goal of treatment you're wanting to have with this treatment, whether it be increased air entry, mobilize the secretions, assist their cough, teaching or education or prevention of whatever. Suggested frequency of treatment. Sometimes here, if it's really a short-term chest thing, I might say 5 times a week for 2 weeks and PT to reassess or something like that. And then I'll go back to my name sheet and I'll write in 2 weeks, reassess so-and-so for chest. Who's going to be providing the treatment? Is it the PT or the PTA? Obviously it's for the PTA, which is why we have this form, but it's just to make it all complete for the college guidelines. And then your name, your signature, and the date. What I have determined with my assistants is I always circle deep breathing, sustained maximal inspiration without percussions, and pursed lip breathing all together. I usually circle all 3 and check it off and say, for example, times 10. My PTAs know that when I want them to do deep breathing, it means they take a big deep breath in, they do the sustained maximal inspiration for 3 to 5 seconds, and then they pursed lip exhale. That's my deep breathing exercise, is all 3 together. So I usually just circle all 3 and say times 10 reps. If you want them to do them separately, you can check them off separately. So that's up to you. So that's the chest physiotherapy program. And so now we'll take a look at the physiotherapy TENS parameter form, and that's what it looks like. It's got the body diagram on there. And again, this is a one-sided form, so another communication tool between yourself and the PTA to let them know where you'd like the TENS to be applied. Again, resident name and date of birth at the top of the page. You can draw the electrodes actually onto the body diagram, and you can show that if you want the cross wiring or the parallel wiring for the TENS, if you've got 4 electrodes. You can check off the region here, just in case. How many electrodes do you want to be used with the treatment? Is it 2 or 4 or other? What pulse width, pulse frequency, what's the time of treatment? I put the default as 15 because I think most of us would do it for 15 minutes with the option of other, of course. Frequency of treatment 3 times a week, again with the option of other. And the waveform continuous burst modulated. Most of our TENS machines have all 3 choices, so I thought it would be important to have that on there. And any comments that you have. So again, from the sensation testing form, if when you're doing your sensation testing you find there's an area of their skin that is not as reliable for sensation, then you can actually indicate that area on the body diagram form, which makes it very easy for the PTA to know where not to place the electrodes in case of a security or a safety issue. That's the physiotherapy TENS form. Okay, let's take a look at the physiotherapy quarterly reassessment form, and that's what it looks like. In nursing home and retirement homes, it is the same. It's also similar in the community homes. The only difference is at the top it says in-home physiotherapy quarterly reassessment instead of just quarterly reassessment or physiotherapy quarterly reassessment. So this is what it looks like. And basically it's got The same information is on the initial assessment form. However, to make it a little bit faster for the chart review, we have put medical status, medications, and cognition all together, and a lot of times these things stay the same, so you can just check off ISQ if it's the same and refer to chart. I should use the other side of the form because I've got holes punched in here. There's actually a little spot here for diagnosis, so you can write the diagnoses of the resident in this box. I forgot to mention this in the initial assessment form part, but I tend to write the short form for any type of medical conditions that may be precautions or contraindications for modalities later on. So I transfer that from my initial form to my quarterly forms all the time, every 3 months. So for example, if somebody has diabetes, I would write DM and circle it at the top of the form, the quarterly and the initial. If they've got metal somewhere, if they have cancer, a history of cancer, any sort of precaution or red flag thing that you notice in their history that may be a precaution, RA for example, rheumatoid arthritis, you can just write the acronym or the short form for it at the top of the form and circle it. I suggest anyways, it's just a quick reminder that they actually have something that's a red flag in case you're thinking, you know, a year from now you might think, oh, I think I'd like to do ultrasound on this person, and then when you look, oh, actually they have a history of cancer, maybe I should check into that a little bit, or whatever the case may be. For falls or any incidents that they may have had, you can, if you're aware of any recent falls, you can document it here, or you can just check off refer to chart. Subjective, objective with swelling, ambulation, transfers, and the rest of it is pretty much all the same as on the initial assessment form, a little bit squished with less area to write because this is a reassessment. Is there anything else different? I guess for the objective part, for the Tinetti, the tug, the unipedal, and the 3-minute walk tests, there is a spot there where you can actually indicate is there an increase or decrease in their score since the last assessment, which may help you in your goal making, goal setting. Still have a room for your clinical impression or your analysis, room for resident goals, and the same box is for agreed goals and treatment plan with the length of time in which you would like to achieve the goal, as well as the spots to fill in the blanks, and the treatment plan as well for 3 times a week, 5 times a week, or as specified below. And then your name and signature and date. So that's pretty much the same as the initial assessment form. And these are usually, it's the same, it's a double-sided form, but it's the same quarterly assessment on one side, and then 3 months later you can do fill in your quarterly assessment on the other side. So you've actually got 6 months, 2 quarterly assessments on one sheet of paper, which helps to save space in the binders and the charts, because we all know how much paper we can get into the binders eventually. So I do encourage you to use both sides of the page, and that's our quarterly reassessment form. And so now let's take a look at the physiotherapy post-fall reassessment form. This is a one-sided form. This is what it looks like. And basically this was developed for nursing and retirement homes. We do get referrals sometimes to go and see residents after they've fallen, especially so in nursing homes. We may get lots of them. And at the top of the form we have the resident's name, room number, date of birth, the date of their fall, the date that you're reassessing them, if they had a head injury, what's the description of the event from the referral that you received, or your discussion with the nursing staff. Does the resident remember falling, yes or no, or they can't answer? What's their version of the fall? It's not always the same as what the staff tell you. Basically want to know, does the resident have any pain related to the fall? Yes, no, or unable to answer. Do their present cognitive impairments increase the risk of falls? Yes, no, or not applicable. And then, are there any significant changes in range of motion, strength, or balance since the previous quarterly reassessment? If you check yes, there is an asterisk there. You may be able to note it just here on the side. If you don't have enough room, at the bottom of the form it says please see other side for description of changes, so you can flip the form to the blank side and write more information about any range, strength, or balance changes since their last assessment if you don't have enough room here.